Good afternoon, and thank you for joining us for our weekly update. I want to recognize first that it's National Nursing Week and also Police Week here in Ontario. I want to thank the thousands of frontline nurses and the officers who have stepped up in a big way during this crisis. You don't have an easy job, and this fight simply wouldn't be possible without you. Today I'm joined by Dr. Lawrence Lowe, our Chief Medical Officer of Health here in the region of Peel, Tim Beckett, our Fire Chief, who also is our Manager of our Emergency Operations Centre, and Chief Duriapa, Chief of Peel Police. It's hard to believe that we're now in the 9th week of this pandemic. Here in Mississauga, we've been under a state of emergency for 51 days, and our Emergency Operations Centre has now been operating at a heightened level for well over 2 months now. We are starting to see the rates of new cases plateau, but we have not yet seen a sustained, long-term, day-after-day decrease. We're skating along the plateau right now, and while it feels like we're not making progress, we are. We are gaining control of this virus, which means we're also gaining control of the outcomes. But we can't let up too soon. I compare this to being on a 2-week course of antibiotics. Around day 8, your symptoms start clearing up. You feel better, and you question whether you really need to finish the course of the treatment. Deep down, you know the infection is still there, which is why the doctor prescribed the 2-week course in the first place. So you just need to stick it out until the end. This is no different. While we're making progress, I know that this is really starting to wear on people. But we just aren't there yet. While I welcome the gradual reopening of the economy, we need to continue to remind ourselves that the picture here in the GTA is much different than it is in the smaller, more remote areas of the province. Cases as a whole in Ontario are declining, but that is not the case here in the GTHA. This is the tale of 2 pandemics in Ontario. As the most populous and dense area of the province, the GTA accounts for over 60% of all cases in the province. Unfortunately, we are the outliers, which is why we must take this slow and steady. Since the start of the week, 25% of all new cases in the province were reported here in Peel. Our neighbours to the east in Toronto accounted for over 50% of all new increases in Ontario. Combined, Peel and Toronto account for roughly 75% of all new cases in the province this week. We are making substantial progress, but we can't get ahead of ourselves too quickly, or we run the risk of a second wave, and none of us wants that. My message to the province is clear. Premier, Mississauga is not yet ready to reopen up this quickly. I call on the province to take the situation across the GTHA into consideration in advance of tomorrow's announcement on Phase 1 of the reopening. While I understand the desire to move forward as a province, I truly believe that we need a tailored, regional approach for the GTHA, driven by localized data, much like other jurisdictions who have been heavily impacted by the virus, including New York and Quebec. This approach would complement the province's framework for reopening. I'm also calling on the province to consult with municipalities before making decisions of this magnitude. We are on the front lines, and we're responsible for enforcing any decisions that are made. We need time to get our house in order. In Mississauga, we will continue to take the lead from our medical professionals when it comes to our reopening. We will remain in lockstep with our Chief Medical Officer of Health throughout this process. We also need to make sure that our hospitals have the capacity to handle new cases. Right now, Trillium Health Partners is operating at 89% capacity, and while they are prepared to open pandemic tents if necessary, I think we can all agree that we'd like to avoid that at all costs. When we move forward here in Mississauga, we will do it together with the collective goal of fiercely protecting the gains that we have made. With the Victoria Day long weekend coming up, we know it's not fair to ask you to stay in all weekend long. With the weather expected to warm up this weekend, please be reasonable and use your common sense. Stay local and stay apart. Amenities and parking lots in the city will remain closed. If you do head out, think about whether you really need to. We don't want people just finding things to do this weekend, so please don't rush out to stores to try to get ahead of spring renovation projects. If you do head out and if you see a crowd, do the right thing. Turn around and go home. We will be enforcing the rules, especially at known hotspots such as Port Credit and the parks along the waterfront. To that end, we have issued 123 COVID-related tickets. That's 7 since my last update. For the most part, we are seeing greater compliance here in Mississauga, and I ask that as we approach the long weekend, that you keep up the good work. We continue to keep our city moving despite these uncertain times. Today, our council hosted our 8th virtual council meeting, where our discussions focused heavily on planning what recovery will look like here in Mississauga. To that end, we voted to approve the city's Mississauga's COVID-19 framework. This framework will help us navigate how Mississauga moves forward and recovers from the effects and impacts of COVID-19. There is no doubt there will be lasting financial impacts to the city and the economy as a whole from this crisis, but I'm confident that we will emerge stronger than ever before. I'm proud of this plan because it incorporates feedback from over 600 groups and businesses across our city and formalizes our path forward in a way that is safe, efficient, and inclusive. It identifies 4 pillars of the recovery: 1, community; economic, finance, and corporate, and 4 key stages to guide that recovery that will see us develop a reopening framework, craft plans based on service priorities, execute a phased plan for reopening of closed areas in line with recommendations made by public health in coordination with the other GTA municipalities, and 4, start looking at longer-term plans that can be implemented once a vaccine is available. The road to recovery will be long, but we are ready to navigate whatever the future may hold. Cities are not immune to this economic crisis. As you've heard me say several times, our city is currently has an operating deficit of over $40 million, which could balloon to over $100 million by the end of the year without support from the provincial or the federal levels of government. The region of Peel is projecting a $36 million deficit and a $400 million loss in revenue from development charges by the end of the year. We are doing our part to address the deficit and are the only level of government that has to make the tough decision to lay off staff. As we move forward, we ask the province and the federal levels of government to work together to provide relief for cities. Please, leave the jurisdictional politics at the door. This province and this country can't afford to allow cities to fail. We are the economic engines. I was pleased to hear Premier Ford say earlier today that he will come to the table to address municipal shortfalls, but he needs the federal government to join him as well. I urge both levels of government to bring us to the table and start these conversations immediately. While this pandemic has shaken us, it has not broken our spirit. Mississauga's business community is determined, it's strong, and it's resilient. I know that many are feeling the pressure. The way we do business has dramatically changed, and we will all need to adapt. But I've been heartened by stories of retail businesses along our main streets starting to bounce back with the reopening of curbside pickup and delivery earlier this week. Let's continue to spread messages of support and hope to our entire business community. To that end, I ask eligible landlords who haven't already, prepare to apply to the provincial and federal rent relief program. Recovery will take a team effort, and we must not lose sight of our collective goal to ensure that our local economy and our business community not only survive, but thrive after this pandemic. While I agree that we need to get back to business here in Mississauga, we need to be cautious, and we need to do it right the first time. And now I'd like to turn it over to our Chief Medical Officer of Health here in the region of Peel, Dr. Lawrence Lowe, to provide us with a brief update on Peel's response to the virus. Dr. Lowe.
Thank you, Madam Mayor, and good afternoon. I echo Mayor Crombie's comments. While the picture here in Mississauga is improving, we are far from returning to normal. COVID-19 remains a real and present threat. Yes, our curve is flattening and new cases are coming in lower and lower numbers, so it seems we are getting things under control. But the point is that we still have new cases. And even though many of those have been found in senior settings, we are still finding some in the community, which means that community transmission remains established. Among the 1,694 cases of COVID-19 in Mississauga, we know that 1,155 have recovered and 161 have sadly passed away. Our thoughts certainly are with those who have been impacted by this, and I know that Mississaugans have also stepped up to bring this fire under control. Your sacrifices are bearing fruit, but we must continue to move cautiously. Other places that have reopened ahead of us have shown that months of progress can be reversed if we are not careful. For that reason, our picture in Mississauga is different from elsewhere in Ontario, though we are all battling the same virus. Our path to reopening must thus be different as well. And as we prepare to discuss reopening, we must continue to take steps to stay safe. First, I repeat, distance is your friend. When you are out and about and interacting, stay 2 meters apart. I often get asked, how far apart is 2 meters exactly? The easiest is to think of this. Think about how far back you stand as a courtesy when you're waiting to use an ATM. If you can imagine yourself falling forwards, you should land comfortably away from the other person without contacting them. That is a minimum, and that should be your practice with every close interaction outside now. Secondly, do wear a non-medical mask when you can't physically distance, like in a grocery store aisle. And finally, by all means enjoy the weather this long weekend. Get some exercise or a walk, but as the Mayor has said, stay close to home. Avoid scenic hotspots, crowds, and gatherings, lest they become viral hotspots too. And do try to stick to the essentials only. These are the things we can do and the things that have worked. Finally, I wish our nurses and police everywhere in Mississauga and the region of Peel, in their weeks of recognition, your work is vital to keeping our community safe. Let's keep this going, Mississauga. Please remember to do your part and stay apart for a little while longer. Thank you, and I'll pass it back to Madam Mayor.
Thank you, Dr. Lowe. As I mentioned earlier, it is Police Week here in Ontario, which is a great opportunity for our entire community to thank the men and women in uniform who work day in and day out to keep our city safe. Our officers, under the leadership of Chief Nish, have stepped up in a big way to provide the province, to enforce the province's and emergency orders in addition to handling their regular workload. Our police have faced very unique challenges during this crisis, and I'd now like to invite up our Chief of Police, Chief Nish Duriappa, to provide us with an update on his force's response to COVID-19. Chief Nish.
Thank you, Madam Mayor, and thank you for the opportunity on behalf of Peel Regional Police Service to bring greetings on behalf of the organization during National Police Week, and I know it is Nurses Week as well. However, we do like the opportunity to address some of the concerns that the public may have during the pandemic as it relates to community safety and the well-being of its citizens here in Mississauga. The first one that has come to our mind and is a concern that we were monitoring right from the start of the pandemic is that related to road safety. We understand the behaviors and the lack of volume of traffic on the roadway has created the opportunity for drivers to take advantage of the additional space, so to speak, and from which there is an obvious concern for speed-related accidents on the roadway. I can say that in Peel Region and the City of Mississauga, we've seen a reduction of motor vehicle collisions, which is a good thing, and we know that's also related to weather conditions as well. However, we have seen an increase in stunt driving and speeding. The proportionality, considering the reduction of volume of traffic, is such that we have seized 25 or 26 impounded vehicles the month of April, and that is all related to speeds in excess of 50 kilometers an hour. Dr. Lawrence Lowe would agree that during the pandemic, we are encouraging people to stay home, and essential travel is what will keep the roads safe. But that being said, Peel Regional Police is committed to ensuring that public safety on the roads is number one. Some of these activities has been the addition of officers undertaking speed enforcement, a variety of traffic-related initiatives, resulting in license suspensions and additional traffic tickets being issued. We must say that during this week, which is also National Road Safety Week, we want to encourage the citizens of Peel to be mindful of others on the roadway, to ensure that their speeds and the road safety, especially as pedestrians and additional people might be on foot, taking advantage of the weather that is out there. Another concern that we have been monitoring pertains to the isolation of individuals within their home. We know that the pandemic has caused an inability of people, whether they be individuals of youth, seniors, or those exposed to intimate partner violence, to have a lack of contact with either friends, family, support networks, or even institutions where they might normally have had contact with those that were able to help them. One of the things that we're monitoring is an increase of response to these concerns in the community. We need to say that Peel Region and the City of Mississauga is strongly committed with our partners, whether they be health, both school boards, the Peel Children's Aid Society, crisis hotlines, our shelters, to ensure that the public knows that access to crisis help is there at your fingertips. Please, please, please call if you need help. We encourage family, friends, or support networks to check in on each other, just as we would do for those that have health or are elderly. This applies to our young people and those that might be in isolation and need the help of those that are around them. Peel Regional Police also continues to work with the City of Mississauga to ensure that we enforce the provincial emergency orders that are still in effect, and we'd like to remind individuals that has been extended to June 2nd. And during that period of time, you may see municipal or Peel Regional Police officers ensuring that we have compliance, whether they be essential businesses or in public places. We know that through the pandemic, the motto of Peel Regional Police is a safer community together. We believe that we can manage the pandemic with the same heart and mind of make sure that we do this collaboratively. Thank you, Madam Mayor.
Thank you, Chief. I want to close once again by asking residents to please keep up the good work. With the Victoria Day long weekend fast approaching, I ask that you just hang in there as we continue to do the right thing here in Mississauga. Enjoy the out of doors, just as the Chief has said, but stay local and stay apart. This is also a reminder for the time being that we have banned the sale and the use of fireworks here in Mississauga, much like many other municipalities in the GTA. While I know that this must be an unpopular decision among some, it is the right one, and we did so for several reasons, mainly to prevent the gathering of large crowds, and generally to see people, not so that we don't see people coming together for fireworks over the long weekend. We also know that they pose a fire risk, and we usually see an increase in both emergency calls and complaints to 311. Right now, we need to keep our firefighters and our enforcement staff focused on the task at hand, and that is fighting COVID-19, period, full stop. So please, however you choose to celebrate, be smart about it and use your judgment. Thank you. I'm now happy to take questions from the media.
Mayor Crombie, your first question comes from Derek Dionaren from CBC News. Derek, please go ahead.
Hi there. Thanks so much. I appreciate your time. Mayor Crombie, I'm just looking into, the response to homelessness within Peel. Are you satisfied with Peel Region's COVID-19 response for those experiencing homelessness in the community?
So certainly this was one of the early issues that we attempted to address early and quickly. By the region of Peel, we set up shelters for those homeless individuals who were suffering from the effects or who were COVID-19 positive. So we do have a shelter in which once diagnosed, they retreat and can have full care at our shelter in Mississauga.
And just to follow up on that, do you see any of the temporary housing being provided as permanent solutions after the pandemic is over?
So certainly what we have done is rent and lease facilities in different apartments, but also in different hotels. And they have been for pretty much exclusive use of frontline workers who need the break or need to be separated from their families, and also those of whom are COVID positive, as a safe place for them to recover as well. So certainly that is a road that we can go down and discuss at the Region of Peel whether we'd be willing to entertain some of these sites. Many of them are hotels, however. It's good use for them temporarily, since many of those hotels are shuttered right now. But going forward in the long term, we will be discussing housing as we always do, and how to address the long waiting lists that we do have in Peel.
Your next question comes from Ashley Newport from Mississauga. Ashley, please go ahead.
Mayor Crombie, earlier today at the council meeting and then just now during the press conference, you mentioned that Mississauga is ready to reopen as quickly as perhaps the province wants to reopen. I'm actually wondering if, because you have emergency powers as the mayor right now, if the province were to say, you know, starting Saturday, golf courses, marinas, et cetera, are open, do you or the city actually have the power to say we're not ready yet and not open these facilities in tandem with the province, or is that something that you cannot do?
Actually, we take our guidance, Ashley, from the Medical Officer of Health, Dr. Lawrence Lowe, and we work in tandem. And I'm taking my advice from him. I know Mayor John Tory in Toronto listens very closely to what Eileen Davila, his Medical Officer of Health, says as well. So should we want to open, I would turn to him for guidance. And at this point, he and I both agree that it's too early and too soon to reopen many of our businesses in Mississauga.
Okay, and my next question is for Dr. Lowe.
Certainly.
Hi, Ashley, go ahead with your question.
So you mentioned earlier that we're still seeing a decent amount of community spread in the region of Peel. I'm actually wondering if you have exact numbers, like what percentage of new cases are community spread versus long-term care spread?
So Ashley, the specifics are actually available online at our peelregion.ca/coronavirus website. There's a weekly epidemiologic analysis that you can review, which will actually show where the transmission was, whether it's institutional, community, et cetera. And then there's actually a neat graph in there that actually shows by onset date which ones were institutional, which new cases were institutional and which were community, so you can continue to track the trend lines during that time. I think the other thing that I would mention as well is that we do know that there are also many people who have very mild symptoms or are pre-symptomatic who may have COVID-19 as well. And I had mentioned at an earlier press availability this morning that there are discussions ongoing to really look at the testing criteria that we have to really see if we can start to interrupt greater chains of transmission by identifying other people who maybe don't necessarily have as severe symptoms in our community, and that will help to really pin down the nature of spread in our community. So those conversations are ongoing, and our weekly epidemiologic summary is a resource for you and for everyone in the community at peelregion.ca/coronavirus. Thanks for the question.
Mayor Crombie, your next question comes from Isaac Callan from The Pointer. Isaac, please go ahead.
Hey, Mayor Crombie.
Hello, Isaac.
You mentioned reopening is quite a local issue, and I was wondering what steps are taking place between the region of Peel, the city of Mississauga, and the city of Brampton to make sure that the response within Peel itself is coordinated and that you're on the same page.
So it's a very good question, and let me also share with you that on Monday there was a call among all the mayors of the GTHA, and we agreed that whatever actions are taken, we would do so in unison, in unity with each other, but more so that we would all follow the advice of our public officers of health. And we think that using data and evidence is foremost in our minds. We want to do the right thing, but we want it to be evidence-based. So right now what we're seeing is the numbers are jumping up, back and forth, up and down slightly between increases of 25 to 35, sometimes 50, sometimes 11, sometimes 100. So they're still increasing and decreasing and fluctuating. We are peaking. We have not plateaued, and what we have not seen is declining numbers as of yet, Isaac, and that's why we all share the view that until we have a minimum of 2 weeks of declining, steadily declining, sustained declining numbers, we're not yet ready to reopen our facilities. We risk that W curve. We go back up as hard as we would come down. So we don't want to see that second wave, whether it be in the summer or the fall.
And if those decisions should be based on the advice of people like Dr. Lowe, are you asking for additional powers? If we're talking about a local approach for the GTHA or for Mississauga, does that not mean the city would need to be given more powers by the province?
So, Isaac, really what we're seeing is a tale of two pandemics. The circumstances outside the GTHA are quite different. There are communities which are COVID-free. That is not the case in Toronto. It is not the case in Mississauga or Brampton, where our numbers have yet to plateau and certainly far-reaching have not started to decline. So we are not ready to open, whereas there are communities and are smaller municipalities in the rural areas that are COVID-free and are ready. And I'm sure the Premier is feeling that tug and pull of the GTHA saying we're not ready yet, and everyone else pushing him to let's get the economy going again, where we want to start the recovery. So with respect to other powers, I don't think that's necessary. I'm appealing to the Premier to say it's not a one-size-fits-all solution, because there are different circumstances in different areas of the province. So what may be appropriate in some areas may not be appropriate in the most densely populated areas of the GTHA. So we were going to heed the advice of our officers of health, and I think they're pretty much in concert with each other that it's too soon.
Mayor Crombie, your next question comes from Steve Cornwell from the Mississauga News, and this will be your last question. Steve, please go ahead.
Hello, Steve.
Hi, Mayor Crombie.
Hello.
We're talking, or you mentioned earlier on that you're kind of hoping that the Premier and the provincial government work more concretely with municipalities, especially in the GTA and GTHA. Can you tell me, has there been kind of detailed consultations to date with Mississauga and the province involving reopening?
We have met. I actually had a call with Minister Steve Clark on Monday as well, and certainly made the same appeal to him. And our large urban mayor chair, who's Cam Guthrie of Guelph, we certainly had a call with a number of ministers and echoed the same view. But the mayors of the GTHA on Monday have sent a joint statement, a news release to the province with all our signatures on it. We're all signatories saying, please slow down because the GTHA is not yet ready. So I know that Mayor Tory has spoken to people at the province. Other than the Minister for Municipal Affairs, I have not on this topic this week.
Okay, and the city council went over the framework for recovery for Mississauga this morning.
Yes.
Yeah, at framework for recovery this morning at city council. I'm just curious in terms of what announcements may be coming from the province the next few days. Like, to what extent can the province kind of undercut Mississauga's plans for kind of a phased-in reopening if things open up too soon?
So we hear the plans are not firm yet. So I think the Premier, certainly he will have heard myself, Mayor Tory and others speak on this issue. We're speaking with one common voice, and we're asking the Premier to please slow down. Our economies in the GTHA, where the population is the densest in the province, to let him know that we are not yet ready for reopening and for the recovery. We're starting to plateau, but we have not yet started to see a decline, a consistent decline in the number of COVID cases.
Mayor Crombie, we actually have one final question from Ashwari from Red FM. Ashwari, please go ahead.
Hi, Mayor. I have a question about financial aid. If you can tell us about the progress, if any, in seeking financial aid from the federal or provincial government to deal with the impact of COVID?
Well, that's a very good question, Ashwani. So certainly I can go over the fiscal situation as it is in Mississauga today. We are currently at a $43 million deficit, $50 million by the end of June, $50 million by the end of May, $60 million by the end of June. We are losing $7.5 million a month in transit revenues, and And the situation is the same right across the province, but it's same right across the country, quite frankly. Many of the cities, large cities across the country, are facing liquidity issues. We are in a very fortunate position to have healthy reserves and an extended line of credit. We increased our liquidity going into the pandemic. However, we know that given the situation, it would equal a 17% tax increase next year. Now, that is not the case because we would obviously go line by line item through our budget and make the cuts where necessary. We have appealed to the federal government through the Deputy Prime Minister, Chrystia Freeland, and other ministers as well. The big city mayors of Canada meet regularly once a week. The large urban mayors of Ontario meeting sort of bi-weekly as well, in meeting with the provincial the provincial ministers, both of Minister of Municipal Affairs as well as the finance ministers. And we have all written letters to the finance ministers and others to make them aware of our financial situations and the deficits that the municipalities and cities across the countries are facing. So we have asked them to step up, and we are very fortunate to hear today that the Premier has said that he is hearing us. They've provided support for small businesses, for individuals, and this week for large businesses. So now I'm hoping they're turning their attention to the municipalities, the cities across our country that are the engines of the economy, that will lead the recovery, and that are responsible for paying for the essential workers and the frontline workers in our cities, in our country.
Oh, thank you so much. Thank you.
Mayor Crombie, I do apologize, but you do have one final question. The question comes from Khaled at the Iranian Times. Khaled, please go ahead. This will be the final question. Thank you.
Thank you so much. It's just my second home TV and Akhbar Canada, not the Iranian. Mayor Crombie and Chief Nish, thank you very much. I have a question. We have seen staggering number of carjackings in different areas of Mississauga right now. And unfortunately, these incidents tend to happen in a little bit neighborhoods that a little bit upscale, and also neighborhoods that used to be very quiet and safe. People are concerned, especially in this time when people are wearing masks, because lots of the carjackers were wearing masks. How can we tackle this, please?
Khaled, thank you for the question, and I think we'd all agree that any risk to the public safety, to people's confidence while they're traveling or driving, is always unsettling. I think I need to just, first of all, clarify that, whether it be an incident which we've seen of a carjacking, we know that statistically we're monitoring these trends, which are overall what we would qualify in the policing sector as robberies. And they are, for clarity, we're seeing a decrease just generally by the fact that people and volume of people out traveling is reduced. That being said, one is too many, and we would all agree that these are disheartening for the community to see. So that being said, I think from a crime prevention standpoint, we've seen a significant amount of success in identifying individuals, despite the fact that those that wish to victimize others, regardless of what type of incident, would like to conceal themselves. We do have a strong capacity to investigate them. We're thankful, as always, in each of these circumstances, and we implore the public to find video. If you've got dash cams or you've got premises that have videos, we really want that to assist us, because that is the best evidence these days. And through peelpolice.ca, you can find an opportunity to provide that. And we are quite often able to update the public on the resolve of these incidents through our media site and also the information there. But I can assure you that from the Peel Regional Police side, we have our robbery investigators always considering these circumstances. Thank you, Khaled.
Actually, just a follow-up. If you can update us on what happened with the Uber carjackings for the last couple of weeks, please.
Sure. So, notwithstanding that the investigation is sort of still continuing, we do know that, as I mentioned to you, whether you're leaving your keys running while you run into a convenience store or whether somebody's in the course of their business, a vehicle is accessed. In this particular one, Khaled, I don't have the details on the response here, but if you're willing to call through to a respective division, we'll find that. I do know that we have some investigative leads as to where the vehicle was taking, and fortunately the individual involved was safe and uninjured. Thank you, Khaled.
Thank you, Chief Nish, Mayor Crombie, and Dr. Lowe. This concludes today's press conference. On behalf of the Mayor, I want to thank everyone for participating. Our media team will be sharing a link to the video of this press conference with you shortly. Have a great day and stay well.
Thank you very much.